welcome to my micro-tea session. I'm just going to read a little bit of a legal rider just to say that we're all happy to be recorded. Okay, so my name's Mark Darnell. I'm going to be delivering the micro-tea today, and I agreed for this session to be recorded, as it is my micro-tea session. At the end of this statement, I just needed to say we all agree. So we're all in agreement to be filmed during this micro-tea session with your learners, and then they all reply, yes.
Yes.
Excellent, thank you very much. Okay, so today we're going to be covering assessing and treating your patient, which will include the recovery position. If no one's heard of what recovery position is, and you don't think you're able to do it at the end, just let me know, and we'll come to an alternative. Or you can direct other people. Cool beans. Okay, so a few housekeeping rules. We've got a fire exit, which is straight ahead just over yonder. And we have a toilet, which is just out this door and then turn to the left. Mobile phones, if you can please switch them off, put them on silent, or if you do need an important call, just leave. And obviously respect, we're in an area of respect, everybody's opinions are equal. If somebody comes up with, there's no silly answers, just make sure that you're happy with everything. So our learning outcomes for today is what we're going to do in regards to what an unconscious casualty is, dealing with that unconscious casualty, what is Dr. ABC, understanding the recovery position, putting someone in the recovery position, which again, if you have any difficulties, just let me know, and obviously dealing with a conscious patient. So through the session we'll understand what an unconscious and a conscious patient are. Okay, so what is unconsciousness? Unconsciousness is where someone's not awake or not aware or responding to their environment. So basically, they're not asleep, they're doing something else. Okay, and this is where it says the difference between being asleep and being unconscious is that the person will not wake up. So no matter how much you tap them, make any noise, they're not hearing you, they're not doing anything. Okay, if a person becomes unconscious, they require medical intervention or first aid because there's obviously a reason why they're lying on the floor, not responding to you. Okay, so why the fuss? Why should we be worried about someone being unconscious? When you go unconscious, all your muscles relax. And your tongue, so if you just go there, obviously that will fall back into your throat and block your airway. So you can physically choke on your tongue. So this is why we need to attend to somebody as much as possible. Also, when all your muscles relax, everything that's in your tummy will come out. And everything that's in your intestines will also come out. So you may wee yourself, you may pee yourself. And obviously we don't want anybody like that. So we obviously need to offer them as much aid as possible. Okay, so we deal with our patients through a process called Dr. ABC. Has anyone heard of this process before? Yeah? Okay. So we're going to look at what each of the acronyms, it's called an acronym, we're going to have a look at what each one of them means. So D, if we start at the 10, is danger. So when you come across your unconscious casualty, you're looking for any danger, because obviously we don't want to put yourself at risk. So within this picture you can see there's lots of potential incidents that could be caused. You've got a car out there, you've got an open gate, you've got water, you've got a strimmer, you've got shears. You've just got to be aware, before you rush into something, take account of everything that's there, just so you don't end up harming yourself or other people as a direct result. Okay. So we've done the D, so we know that responds to danger. What do you think the R stands for? So you check for danger. Response. That's correct. Okay, so what you're going to try and do is you're going to try and get that person's attention. Obviously you can shout, they may just be asleep, they may have their earphones in, they may be listening to some music. The best thing to do is what we call talk and tap. So just tap them on the top of the shoulders, and obviously ask them a direct question like, open your eyes, are you able to hear me? Things like that. Obviously, if you're getting no response, things are getting a little bit concerning. There used to be the next section used to be called S, where you used to shout for help. At this particular stage, that's been taken out of the guidelines from the Resuscitation Council. So at this stage, if you're getting no response and you're by yourself, you want to get someone's attention. So you can still shout, you just don't try it out, or just get attention somehow. So talk loudly, do whatever you need to do, knock something. just so you can get someone's attention, because obviously it's getting quite serious if they're not responding to you. Okay, so that's the R taken care of. What do you think the A stands for? So obviously we've checked for danger, we've checked for response from our patient.
Airways.
Airways. Okay. So obviously what we want to do is we want to make sure that the airways are clear. We just mentioned in regards to your tongue flopping. So what you want to do is you obviously want to make sure that the head's tilted back. The way that you do that is just put your 2 fingers on the forehead, 2 fingers on the chin, and just tilt the head back. And you should be able to, you know, you should be able to hear them breathing if there was any obstruction. Okay, so that's the airways taken care of. What do you think the B stands for?
Danger.
Breathing.
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 Breathing, that's correct.
What is it?
Okay, so like we tilted the head back, while you're down there, just obviously get your cheek as close as you can to them, and you're going to do a process of look, listen and feel. So you should be able to feel the breath on your cheek, you should be able to listen for any breaths, and most importantly, you should be able to feel the breath on your cheek, and you should be able to see the chest rising and falling normally. If it doesn't, then obviously there's something that needs assisting with. So we've got danger, we've got response, we've got airways, we've got breathing. What do you think the C could stand for?
Circulation.
Circulation. It used to be, but it's not this time, they've updated it.
CPR.
CPR, yes. It is CPR, it's doing the heart compressions. It's not something we're going to cover in today's micro teach, but it is something that we'll pick up at a later date. But it is, you know, you've probably seen the adverts with the famous footballer in, Vinnie Jones. Obviously he's doing for the British Heart Foundation, he's doing the hands-only CPR. So that's why I've got a nice pair of hands on the heart. Okay, so that gives us our Doctor ABC. What do you think the D stands for? That's it, defibrillator. Obviously we've now got a heart with gentlemen doing some CPR, and obviously we've now got electrical signal in there. So many buildings will have defibrillators. Again, it's something we're not covering in this micro T session, but it will be something we pick up when we do CPR. But yeah, so you just have a look. You know, if you're in an area you don't know, people may have seen one, or if you ring the ambulance service, they'll be able to tell you where you need one. Okay, so that's our doctor's ABC. Excellent. Now we mentioned, once you get to that stage, and you're still by yourself, obviously call for an ambulance, call for emergency services, and if possible with your mobile phone, try and put them on speakerphone, so you can check your patient, and you can also speak to the dispatcher, or help at the end of the telephone. Excellent. Any questions so far? No? Cool, thank you very much. Okay, so what we're going to do now is we're going to start putting people in a recovery position. It's basically in 4 easy steps. So I'm looking for a lovely volunteer. So does anyone want to put themselves forward? Awesome. If we'd like to position ourselves on the floor.
Yeah.
So this is our demonstration. After the demonstration, you will be doing it for yourself as well in twos, if you want to start thinking who you want to be pairing with. So if you come across your casualty, the first thing you want to do, as we mentioned, is you want to do your talk and tap. Hello? Hello? Hello, can you hear me? Can you open your eyes? Obviously I'm getting no response from him. So what I want to do first of all, is I just want to tilt his head back and open his airways. His jaw should drop open. And then what you want to do is you want to look down the chest for no longer than around about 10 seconds. If you start breathing within a couple of seconds, they're fine, you know they're breathing. And this is where you're going to put them in the recovery position. If they're not breathing, you can't feel anything, this is where you'd go into your CPR, but we're not going to go that far at this stage. Okay, so to do the recovery position, the first thing that you do is get the hand that's closest, furthest away from you. Put it away. So put it. You should normally put it in a right angle. Most gentlemen, their arms won't go down in the right angle. So with the other hand that's closest to you, just put it across to the cheek. Okay, hold on to that one. Then what I'm going to do is we're just going to walk round. Just so I don't have my back to you, okay. Well, the arm with the leg that's furthest away from you, you're just going to make a triangle. Okay, because this is going to be your lever. So what I'm going to do is I'm going to roll David towards me in a steady motion. Okay, so roll him over. There we go. Just come across to me with his leg. I'm just going to push it further up into a 90-degree angle. I'm going to check his airways again. And he's still breathing. And that is quite simply the recovery position. Okay. Going to roll you back, David. And now it's your turn to have a go, so if you want to start getting into twos, have a go.
Perhaps if we do 2 groups, what
Yeah, if you want to go
do
into
you
2 groups.
reckon?
Because we've not got that much floor space.
I'm not
to play
hearing,
with.
I'm just sat.
No.
That's fine, that's no problem at all.
Right. Can I have 2 volunteers to be on the floor? Jennifer, Steph. Oh, I need you on Saturday. Right. So would you like me to supervise?
Yes,
one and
this
you
is Gail, she's one of our trainers, and David's also one of our trainers as well, so they
Right,
will be
who wants to
officiating to make sure
have a
everything's
go
okay.
on this one? Come on then. Right.
Hello Jess, do you want to have a go?
Right. Which side are you comfortable?
You open your
This,
eyes.
that side? Right, go on then. Right, do you remember what Mark said? We've done the Dr. A, B, C, D, and so we're just going to check that she's breathing and put her in the recovery
Are you
position.
doing the response as well?
One thing you've got to remember as well
Right.
is if they're wearing glasses,
Come on.
take them off as well. And also check the pockets as well. Sorry, I didn't demonstrate that, but
Okay.
David's glasses are good.
If you want to do that, up and talk and everything, that's fine if you want to do that. But what we need to make sure of with this is that you can actually put her in the recovery position. Okay. You alright,
That's
you
good.
two, yeah? Right. Right, go on.
Is she still breathing?
Yeah.
Is it comfy down there?
Hear me, you open your eyes.
Excellent, thanks very much. Next one please.
There's no response. Right, so what
Debbie.
we'll check for yeah.
Meet Steph.
You may have recognised it from somewhere.
She's breathing, isn't she?
She is.
So, what do we need to do?
okay?
What is she wearing?
Glasses.
Right,
Just going to remove your
Just going to take your
glasses.
glasses off.
okay. Gonna
Just
put
put
them
them to
somewhere
one side.
safe, yeah.
Yeah, just turn
Brilliant.
her back slowly,
Right.
that's it. You're just looking down the
They
chest.
are.
Is anything?
Yeah, check anything in your pockets.
She's breathing.
Girls tend not to have a lot, it's men in that you have it, right. About that on.
Just going to move this arm to one side.
Yeah, okay. For this one.
Just going to link the arm.
The thing is as well, if she's wearing any
Yeah.
jewellery, what you do
Yeah,
is you turn it
turn
over,
it round
so
on,
you don't
yeah.
scratch your face, yeah.
Yeah,
She's got
Okay.
her watch on.
keep
That's
hold
good.
of that, that's it.
And she's got nothing in the pocket.
That's
This
good.
is this
Yeah, you can
one.
tell very tight
Yeah,
jeans,
it's
aren't
jacked
they?
out.
Right, right,
I've been lucky with
and
that.
you're bringing her over onto your lap.
Yeah, that's it.
She's ever such a good patient, is Jennifer, aren't you? Yeah. Right. Yeah,
Excellent, that's good.
and check the breathing
That's
again,
great.
brilliant.
Can I just say this floor's freezing?
It is
Yeah.
freezing.
Right, okay, you alright for one more?
Yes.
Just one more,
Yeah.
lie down then. Give her her glasses back, please. Who wants,
Do you want to
anybody,
get-
have you done it? No? Do you want to have a go? Come on then.
Why don't you go through the cold? It's quite
So you're
Right.
okay,
Okay. We've checked
Come
all
on Denise, come on
the
down.
danger, danger, right. Come down to your
Are
casualty.
you sure
And
you're
what
okay?
you're going to do, you're going to do what
Okay.
I tell you to do.
Oh God, do not do a
Top.
G.
Right, come on then.
Needs to be relaxed,
So yeah, just checking their response.
No response,
Take off
is
the
there?
windows.
So what are we going to check for next? Yeah? Come on then. And how long will you check for?
That's
Up
it,
to
it's
10
checking for 10
seconds.
seconds.
Right, she's obviously breathing. what we're gonna take off before we move it.
Look at my towel.
Right, pop the glasses over there then.
But does it feel nice? There we go. Just hold on to that hand.
Okay. Right.
And just roll it across.
Right, we're gonna look at the arm nearest to us, aren't we?
Cool.
Yeah.
We need that out the way really, don't we? Yeah.
She's sat on it.
And you get yourself a little bit nearer then, that's it. So what we're
Cool.
gonna do
Excellent,
with this
Tim.
arm.
Do you want to hop yourself up? Thank you.
Hold of that,
She's all-
keep hold, that's it. If you
Thank
let
you,
go,
mister.
it will fall. What are you gonna do with the knee?
Yes, if you want to get down, let's Steph have a go.
1, 2, 3.
3. Up.
We need to make sure that she's well over, that's it, because we don't want to rolling
So
back.
the good
do
thing
we?
is,
What do
is
we
it
check
works
on
on
there?
any, you should be able to, because it works on anybody of any size.
Yeah?
Yeah.
Okay, right, do you want to get up now?
That's what it's been.
I think that's about,
Yeah.
yeah?
Just got Steph to finish up.
Okay.
Orange.
Yay! Thank you everyone. Just wait for David to get up.
Might take a while.
Okay, so that's how you deal with an unconscious patient, obviously breathing. Conscious patient is very much the same, except they'll be awake and all happy. Obviously, if they are feeling a little bit unwell, we're obviously getting into a recovery position. But with a conscious patient, introduce yourself, and obviously they're awake. Find out what's happened and what's caused them to need some help, so they've been shouting help, why they've been shouting for help, have they stood on something, have they done something to themselves, and deliver any treatment. So if they've got a bang on the head or there's some blood coming, then obviously give them some to mop up that blood. And just take a patient history, because if they're feeling unwell, they may need to go to hospital, depending on what's happening to them. Any questions so far? Please. Okay. So, is everyone happy with the recovery position?
Yes.
And everyone's happy what to do with a conscious patient, which is basically just get as much information as possible, find out if they're on any medication, should they deteriorate, and then you put them in recovery position. So obviously this is what we've completed within our learning outcomes. So we found out what unconscious patient is, and how to deal with an unconscious patient. We now know what Dr. ABCD is. We understand what the recovery positioning is and why we use it. We know how to put someone in a recovery position, and we know how to deal with a conscious patient. Any questions? Excellent. Well, thank you very much. I've got some handouts for you over here. The handouts just basically have the recovery position in 3 easy steps. There's keep calm and check Dr. ABC. And on the back, there should be a picture of the open airways as well. So just a few little notes for you to take. I've got some feedback forms for you to feedback on my micro session. So that concludes the micro session. Thank you very much.